Welcome to the Pharmacy Leaders Podcast with your host, Tony Guerra. The Pharmacy Leaders Podcast is a member of the Pharmacy Podcast Network, with interviews and advice on building your professional network, brand, and a purposeful second income from students, residents, and innovative professionals.
At Drake, it all starts with you, and it starts in your first semester. Together, we'll build a path toward your career vision and goals. Whether you're a student in pharmacy, occupational therapy, athletic training, or pursuing other health sciences careers, you can prepare for a career in areas as diverse as patient care, management, public health, research, and more. Drake is where an immersive curriculum combined with community service and a vast alumni network enrich and challenge you long before you walk across the stage at graduation. This is where you build the unshakable foundation that lasts a lifetime.
Hey, welcome to the Pharmacy Leaders Podcast. I'm here with Kristen Butler on Drake University's campus. She's a P3, just about to become a P4, and excited about APPEs. And she has kind of a cool gig on campus, and I just wanted to talk to her a little bit about some of the things that she's doing. So welcome to the Pharmacy Leaders Podcast.
Oh, thank you for having me.
Okay, so first of all, tell me a little bit about your last 3 years. You've been working in admissions, I think, or something like that. And so tell me a little bit about what you've been doing here and what you have for kind of that cool part-time job.
Okay, so last year I got the email to be a TA, and I saw Jess Lang was one of the options, and she actually ran my admitted student interview when I came in as a freshman.
Okay.
So I wanted to work closely with her. So then I applied, and we had our little mini interview, and she wanted me to be her TA. So now I work on the back end of the admission side, so I get to see all the applicants that are coming into the pharmacy program and review their applications and then input them into the databases and help the faculty keep those things organized. And then when I'm not doing that, I get to do mini projects. So right now I'm also working with Michael Nelson to implement the HOSA Day. So I'm finding him, like little projects. They're doing a simulation where they dispense and reconstitute a product. And then, so I'm helping him get those supplies and ordering them and working with other faculty to make sure that we can get events going smoothly for the campus.
Cool. All right. So you're just getting out of your P3 year, going into your P4 year. APPEs you had to choose last October, if I remember right. Mm-hmm. You find out early February, and then they're kind of confirmed, or if there's any issues, you change them around. Tell me a little bit about some of the choices that you've made. First of all, start with maybe go backwards from the end, because I think you end at Mayo, which is more traditional, something more clinical. What are you going to do there in Minnesota?
Yeah, so for my Mayo Clinic's actually a 10-week block, so my 8 and 9 rotation will be there. So one is just a general hospital experience, and then my second block, so to say, is actually
She's going air quotes.
Yeah.
So air quotes.
So the second 5 weeks, I'll actually be in an anticoagulation unit, so I can learn more about cardiac medications and work closer bedside manner with those kind of patients, which is something I think I want to do for the rest of my life, but we'll see how rotations change that.
Okay. And then tell me a little bit about this travel that you're thinking of doing. You're thinking about going to Belize. I understand a lot of students are trying to get out to maybe see a different part of pharmacy around the world, but also they want to be an important part of that. So we'll first talk about Belize and then a little bit about the Indian reservation, where I think you'll get some good experience.
Yeah, so first block I'm going to Belize, and that one really stuck out to me because we're going to areas that don't have as much access to healthcare, and one of the students last year that had gone on it told me it was a great experience for her to learn what medications you can use when you have a limited supply. So, for example, they didn't have a atorvastatin, so she had to learn, okay, we'll do rosuvastatin, or this is an antibiotic they don't have but need, so here's option B that will work close enough. So she said it got her thinking a lot about problem solving, and that's something as healthcare providers we need to know how to do. So I thought it was a good experience to see the world in addition to expanding my pharmacy knowledge. And then after that, third block, I'm going to the Indian Reservation in Choctaw, where I get to be one of the only providers that the reservation gets to see. So that would be a good experience for me to learn more about disease states and how to treat those. Or in class, we learn a lot just about the medications. So it'll be interesting to tie all that knowledge together and become more of a well-rounded healthcare provider.
So tell me a little bit about this kind of altruism movement that I keep seeing with students, that it's really not about them, it's about the patients and how they're really trying to serve patients in need. How did you get started with that?
I guess it was kind of always, I know you're good, kind of trained from the beginning for us. We do the healthcare patient model.
I don't know what that is.
It's like collecting data, assessing data, treat the patient.
Okay. I see the wheel. I see the wheel. Okay, there's arrows in a wheel on this. Yeah.
So Drake does a really good job of training our minds to just think very patient-centered.
Mm-hmm.
It's they still stress, mental health and care for ourselves, but at the end of the day, I think a majority of us just have such a drive to help people that we're willing to learn more and make sure they're the center of everything we do, and make sure that at the end of the day they're happy with their care and trust us.
Yeah, the residencies have responded as well. You're the number 2 school in the country in terms of placement rate for residencies. Not total number of residencies, they're much bigger schools, but if someone from Drake applies for a residency in general, it comes out how well they've been trained in terms of patient care and those types of things. So as you're kind of going through this process, how do you decide whether you're going to do residency, whether you're going to get a job, or is this just way, way too early for that conversation?
Yeah. I think we also hear a lot, residencies are being a push, and we've also heard, I guess, not rumors, but that employers are looking for residencies even in the community field. So I think it depends what the person wants to do. Where I want to go into hospital, so I essentially knew from day one it would be a residency.
Okay. All right. And then you're doing your cardio at the end. What clinical experiences are you going to have before those interviews that come up in, I think, early January and February?
Yeah, that'll be the tough spot. So I'm really hoping I can talk a lot about Choctaw and what I learned in Belize. And then I have a rotation just at a general AmCare too, so I'm hoping I can talk. I have the patient interactions and everything.
Okay.
And then be like, hey, I'm also...
Yeah, I'm not saying you have to do your acute care the day before you... Well, I just had a case this morning before I flew in. Yeah. And then is there anything else that... I've asked you a bunch of questions. Is there anything else you wanted to say to either your friends here or anyone else? Just a shout out.
Oh, boy. That's a lot of pressure, but...
Doesn't you don't have to. You can wait. You're going to be doing some interviews, so we'll hold off on the shout outs for later.
All
right. Well, thanks for being on the Pharmacy Leaders Podcast.
Thank you.
Support for this episode comes from the audiobook Memorizing Pharmacology, a relaxed approach. With over 9,000 sales in the United States, United Kingdom, and Australia, it's the go-to resource to ease the pharmacology challenge. Available on Audible, iTunes, and Amazon.com, in print, ebook, and audiobook. Thank you for listening to the Pharmacy Leaders Podcast with your host, Tony Guerra. Be sure to share the show with the hashtag #PharmacyLeaders.